quality of your mind determines the quality of your life. Rather than trying to change our environment, it's often better to change how our minds respond to the environment. You can actually make changes in your brain in order to reduce needless suffering for yourself and those around you. You can learn to not be overly anxious or overly stressed, or if you're having trouble focusing for very long. Neurofeedback therapy has been proven to make long-lasting changes in cognition, emotion, attention, and pain perception. These changes correlate with both structural and functional changes in your brain. Many of our clients are frustrated because the medications they're given for ADHD, insomnia, anxiety, depression, and PTSD are ineffective once those medications wear away. This is where neurofeedback therapy comes in. We can offer you a more permanent solution to your problems.
Before starting brain core therapy, I had extremely bad anxiety and insomnia. Now that I've been through brain core neurofeedback, it's really given me a second chance at life. I sleep normally now, and every day I'm just happy and going on about my day, and I'm loving it.
This therapy has been approved by the American Academy of Pediatrics as a level 1 best support. So what is neurofeedback? Well, neuroscience has established 4 main brainwave patterns. Delta waves is when our brain is asleep. Theta waves when we're just about falling asleep. Alpha when we're more calm. And beta waves when we're externally focused. A normal, regulated brain will move in and out of these waves throughout the day. Brainwave dysregulation occurs is when it gets stuck in a certain pattern. For instance, if you're trying to fall asleep, but your brain is producing too many beta waves, it's going to be hard to fall asleep. If you're trying to sit and focus in class, but your brain is producing too many slow theta waves, it's going to be hard to focus. Neurofeedback therapy takes abnormal brainwave patterns and makes them normal. It teaches your brain to regulate itself so it can establish new normal patterns throughout the day. It's a drugless and painless therapy. We teach the brain to produce the appropriate pattern at the appropriate time. This is through a process called operant conditioning, which essentially are brain-based exercises. We begin with a comprehensive evaluation where we start with a QEEG. This records the brainwave patterns at 12 different sites on the brain. Our software can then identify where you might have abnormal brainwave patterns. Once we have these results, we can then perform a specific protocol to teach your brain how to regulate itself. For example, if you're producing too much theta waves, our protocol will teach you how to produce less theta waves. One of the brain-based exercises we use is where we'll have a client sit and watch a movie or a TV show on a screen. That screen will go dark when the brain isn't establishing the normal brainwave patterns, and it will get brighter when you're establishing the normal patterns. Your brain then will learn that if it wants to see a brighter movie, it's going to keep that screen bright. And as it keeps that bright, you actually, through a process called neuroplasticity, start growing new brainwave patterns. And these patterns are now brought into the normal environment. Having a normal, regulated brain enables us to see the world more clearly and to experience each moment more clearly. If you or anyone you know suffers from any of these brain-based conditions, please don't hesitate to call us today.